Mrs. Clarkson is the financial manager for a local hospital. She is extremely conscious of the rising healthcare cost. She is aware of the increasing aging population in the country. Consequently, there is an increasing trend of elderly people being admitted to the hospital in the emergency department. In order to tackle this problem, she knows that her hospital has to continue to deliver a high quality of service, but at a manageable and sustainable budget. Mrs. Clarkson calls for a meeting with top advisory board members and representatives from each department. They all agree that through each level of organization, all staff should be aware of the initiative improving quality as a sustainable budget. This eventually becomes a motto of their reform. Mrs. Clarkson then talks to every department and meet with their respective managers. Although the intention is well received, the service improvement initiative is difficult to carry out. A centralized database is set up, but the internal IT staff are not trained to analyze data. In order to ensure the security of data, Mrs. Clarkson has to ask the consulting firm to sign various data protection and information governance forms. Actually, once data are released, it becomes the responsibility of the firm to handle the patient data with care. The consultancy firm cannot offer the standard package price since a higher price needs to be charged for the extra effort in ensuring this security level. Mrs. Clarkson is left to wonder if the cost of subcontracting would be justified by the eventual cost reduction in internal services. That was the original purpose of the initiative. With Exo-brain, the scenario changes dramatically. First, Mrs. Clarkson would introduce her departmental level IT staff to Exo-brain solution. The staff then uploads their data to the platform. The platform has been designed to be secure and allows only non-personal data to be uploaded to the system. Therefore, information governance is light and the risk of leakage of privacy information is extremely low. The legal department only advises Mrs. Clarkson to ask Exo-brain to sign a simplified information governance form instead of the one satisfying the ISO-certified privacy standards. Because of the user-friendly interface, all IT staff soon gets used to the system. Data extraction, processing, and analytics takes hours instead of weeks, and Exo-brain charges only a reasonable price for each analytic task. Since the platform can consolidate data across any department within the hospital, Mrs. Clarkson has quickly a big picture of the service quality, department by department. She can use these findings to talk to the relevant staff members and explore how to improve the quality level. Mrs. Clarkson is not a singular case. If every hospital and other healthcare organization relies on the Exo-brain platform, the country can have a national view of the quality delivered by the healthcare community as a whole.